What I think the COVID-19 virus did is it accelerated our ability to embrace telehealth or virtual medicine. Because before, at least in cardiology, we thought that, you know what, care won't be as good. There's no way patients will do better. But what we found out was, particularly in heart failure management, in terms of how we leveraged virtual cardiac rehab, meaning some is better than none, right? And so as we started to look at these things, we really started to look at outcomes, and whether it was hospital readmission rates, medication use, patients' understanding of their medication, it really forced a lot of cardiologists, present company included, to scratch our head to say, hey, is this a new way?
Everyone, welcome once again. This is Theo Harvey from SensorMed, and we're super excited on our new podcast, Practice Value Creation, really about medical practice success secrets. And today I have Dr. Batts. He is a cardiologist based out of San Antonio, Texas. How are you doing today, doctor?
I'm doing well. Thank you for having me.
Awesome. If you don't know Dr. Batts, he is a board-certified cardiologist with nearly 20 years of experience focusing on cardiovascular disease prevention, nutrition, and fitness optimization. He holds a biochemistry degree from the University of Kansas, where he was an NCAA Division I track and field athlete. He earned his medical doctorate from the University of North Carolina at Chapel Hill and completed his residency in cardiac fellowship in San Antonio, Texas. Dr. Batts specializes in prevention, sports cardiology, especially for tactical athletes and value-based care integration. So Dr. Batts, this is a lot that you're involved in. And one of the things that we really wanted to kind of talk to you about is your specialty around cardiovascular disease. As you know, the Centers for Disease has said that nearly 1 in 2 adults in the U.S. have some form of cardiovascular disease. So what role do you believe lifestyle modifications play in preventing and managing these conditions?
Well, first off, Mr. Harvey, I want to thank you for having me on the show. I had, as we mentioned earlier, I had the privilege of watching some of the ways that you're allowing physicians to not only embrace content, but evolve it in such a way that is both digestible and scalable. But speaking to your question with respect to, 50% of Americans, and we talk about Americans, but worldwide, cardiovascular disease is the number one killer. That's right, you heard me. When you stretch it across time, we know that it has increased over time, and probably by 2050, you ready for this? Those numbers will double. So in that, the question comes is, what do you think about prevention or lifestyle? Well, as you mentioned, I am a sports cardiologist, but in front of that sports, there is a preventive sports cardiology. So what I want to do is keep people, this is going to sound crazy, especially as we try to leverage business. I want to keep people from having to see me. I know I'm not working to put myself out of business with the burden of cardiovascular disease. I don't think that'll be a problem. But lifestyle plays an important role. And so when we talk about lifestyle, I have a saying, and I was going to save it for later, but you got me ready to go. So my saying is, did you take your meds? MEDSSS. What meds are? They're the 6 pillars of lifestyle medicine: mindfulness, exercise, diet or nutrition, sleep hygiene, social connectedness, and finally, getting rid of risky substances. When patients come to see me, my initial discussion is how to reshape how you think about how you live, not giving them medicine straight away. Even though that might be where we end up going, I want them to be prepared to move forward without me necessarily having to hold their hand. If you think about it, patients probably spend 99.9% of their time away from the doctor's office. So we have to start giving patients something tangible that they can take and practice in their own lives.
I love that. And you hit a point, that social connectedness and physical activity. I don't know if you saw, there was a longevity study that talked about that. Those 2 pillars alone were highly correlated to long life, right? And I love how that's part of that acronym you created, because that is so key, right? Having that connectivity. I know my dad likes to go cycling, right? So he has his buddies, he's in his 70s, and they go cycling together.
Man.
And that connectedness, so that's keeping him, active and engaged. And I think that's so important, that men, women, but just everybody kind of stay connected as they do physical activities, because that will show longevity, to your point. So I'm glad you kind of mentioned that in your acronym. When you kind of look at, this whole area of understanding disease prevention, study published in the Journal of American College of Cardiology found that 80% of heart disease is preventable, right? And you kind of talked about that. So how are you kind of guiding patients toward the meds strategy, right? What areas are you saying, hey, this is something that people need help with? Or are you kind of looking at it across the spectrum, depending on the patient?
Well, no, that's a wonderful question. And I think that it is across the spectrum, right? Because I don't think there's any one size fits all. Like today, I saw a patient and she just thought she was coming in to just see me and we just going to have a discussion. But I started asking her about her background. What things did she like to do? And what was her cultural, connectedness? And she said, why as a doctor are you asking me this? I said, because all of those things impact how I have to customize your care. I think long gone are the days where I throw an aspirin and a cholesterol lowering medication and tell a patient good luck. We know that there is what's called precision medicine or strategies where you can identify patients before they have a manifestation of disease and then design care patterns to reduce various things. Now, specifically speaking to your question, how important is it to allow those patients to evolve into their own treatment strategy? I think that's key. So what I usually tell patients when they come to see me is, sure, we're going to navigate this problem, but we're going to help you have, you ready, a continuous fix. So what I do is I say Rome wasn't built in a day. So from those 6 lifestyle pillars, I say for the first 2 weeks, let's just pick one. And we do this successively over the next 2 weeks. And they say, well, why 2 weeks? Well, we know that it takes 21 days to truly change a habit. But once they get that foundation over the 2 weeks, that third week, they've changed that habit, but we've already moved into another one. So there never allows this time for complacency. At the end of 12 weeks, right? So we've got about 3 months. Guess who comes back in for follow-up? The patient. So whether I see them virtually or in person, we have a discussion about which things work well, which things didn't. And I don't ascribe, now I am vegan, I am plant forward, but I don't force my patients to ascribe to a vegan diet or anything like that. But I do challenge all my patients, you ready for this? Another acronym, to stop eating crap. I know your listeners don't like to hear that. But what crap is getting rid of carbonated beverages, refined sugars, artificial sweeteners, and Mr. Harvey, those processed foods. If you just did that, your dietary enhancements would improve. And I tell them, simply put, tell me what your nutrient to calorie ratio is. Should be high, right? But when you think about many of the foods that we eat, they're very dense in calories, but not very nutritious. And so I think that's how we allow patients to identify both their pain points and their points for success as we move through kind of their ability to embrace, engage, and energize themselves through lifestyle.
I love that. I love that. When you kind of talk a little bit about that 99.9% of the time where you're not seeing a doctor, this 1%, right, or 0.1%, this is so key, right, to kind of make sure patients are engaged more. We're seeing things around remote care opportunities, right? How do you kind of keep patients engaged remotely, whether that's through technology, whether it's through virtually, whether that's through just a simple phone call? What are your thoughts about these telehealth kind of tools and technologies to keep patients engaged in their own health remotely when you're not seeing them in the office?
No, I think that's a wonderful question. And I'll answer it first. I'm on another show called the What's Your Revolution podcast with Dr. Charles Corprew, where we talk about issues that largely affect men, but also the people who care for them. And this came up where we had a poignant discussion about both the good and unfortunately the bad about COVID. What I think the COVID-19 virus did is it accelerated our ability to embrace telehealth or virtual medicine. Because before, at least in cardiology, we thought that care won't be as good. There's no way patients will do better. But what we found out was, particularly in heart failure management, in terms of how we leveraged virtual cardiac rehab, meaning some is better than none, right? And so as we started to look at these things, we really started to look at outcomes, and whether it was hospital readmission rates, medication use, patients' understanding of their medication, it really forced a lot of cardiologists, present company included, to scratch our head to say, hey, is this a new way? In one of your shows, and I can't remember it, you talk about, you don't call it, but it's that iron triangle of medicine where you have to try to balance cost with quality, and then that overall piece, that access piece, right? So how do you do that? Because you can't really have both that work really well. And I think through telehealth, we expanded access to places that I can tell you didn't have access to cardiology. Because it's through that platform, there's some move, at least in other countries, where it is cost effective, right? If not for the practice. And then when we look at that quality piece, those metrics are still coming out. But I think that any physician practice or any provider, I'll say it that way because we have a ton of nurse practitioners, PAs, midwives that are doing great work, but any provider that really wants to elevate and leverage that as an opportunity, man, you can reach so many patients, you can see so many people. And if our goal is to do good, this certainly allows us to reach our arms much, much wider.
Mhm. I mean, and small plug here, obviously my company is in this space and we see the benefits of that. I think there's opportunity there to kind of even do more of that, right? I started this maybe 10 years ago. It was rural areas, right? Telehealth was really prominent then, but obviously with COVID, that just opened the kimono to kind of explore this more. And so we're seeing the more and more investments going into remote care programs because they're seeing the data. Are we helping with reducing those readmissions, right? Which is a huge quality measure. Are we helping, like you mentioned, the quality, right? Just like if you weigh yourself every day, right? You can kind of
Mhm.
monitor yourself and you're taking care of yourself. You take your blood pressure every day. You see the little changes that can affect that. So we're seeing some positive impacts, and you're right. The studies are still coming to the forefront. But when we talk about this, a business conversation, when you see how incentives are changing, right? If when CMS, Centers for Medicare and Medicaid Services, are making more reimbursements tied to these kind of programs, I think they see the bottom line, right? They see the dollar
Right.
amount. So they're saying, of course, we're going to keep, doing these programs because on the other end, we're not getting these high readmissions, which can cost them tens of thousands of dollars for every time a patient comes
Mhm.
in. Something that could be preventable. A little biased here, but definitely I think, we can see more of that. I would love to kind of get into your story. You're a physician, but you're an athlete, and, kind of talk about this holistic approach to medicine that you bring to the table, right? A lot of doctors obviously go to med school and they kind of know the scientific approach and, X and Y's and case studies and, say, oh, percentage. I mean, this patient will do this based on their age and all that. But kind of talk about like your holistic approach, as a former athlete, but also as a doctor. How are you bringing that to the forefront in changing patients for the better and helping them?
No, again, another great question. And so that word holistic, it has certain connotations, like I'm floating around my clinic room with ferns and various medicinal plants. And as much as I think that's cool, that's not the case. But for me, my journey in healthcare was really stemmed by my family and my patients, right? I would look at people who, when you looked at them, they would look healthy, but then they wouldn't be around, right? Just something would happen. And you say, how did that happen to that person? The same thing occurs. So let's shift to younger patients, right? So I have kids, and my daughter played Division I volleyball. My son is an excellent football player. My youngest daughter plays volleyball. But when we look at the risk of sudden cardiac arrest in kids, right? But they're exercising. Exercise should be healthy. But what we started to realize was that there's this linkage between, again, albeit small, between exercise having a dose response. Too little could be bad. Too much in some cases can be a problem. So finding that happy medium. And so as I started to counsel my patients about the benefits of exercise, not only duration, but also the type for certain disease conditions, it really allowed me to embrace the ability of exercise to favorably modulate disease, right? There's this process that occurs with cardiac rehabilitation, right? Where someone has a heart attack, their heart is dead, and you force them, or a portion of their heart has died, and you force them in a loving way to exercise. Well, you say that seems counterintuitive, but what happens is the body undergoes a process called neorevascularization. That's where when the cells feel or sense pain, or you're pushing them to that next level, they start to create these tiny blood vessels that create alternative pathways for blood flow. Now, in conjunction to that, you have to create the proper milieu or the proper environment. And that's where nutrition and sleep come in, right? I tell my patients, if you're not getting at least, there was a study that came out in the Journal of American College of Cardiology. They talked about 6 to 9 hours was that perfect sweet spot. Any less, right? We know that your risk of cardiovascular, your hazard ratio goes up about 22%, right? So 1 in 5 folks who don't get that, they have a higher risk. Now, there were some genetic components also. Anymore, there's some thought that due to muscle wasting and various things. But what we found out was that cardiologists need to start talking about sleep, right? That's why that component in your body recovering. So I think as we start to break down these very simple, low cost interventions, sleeping, walking, making friends with people sounds crazy, but we know based on whether it's anecdotal information or patients who have had those experiences, I think it allows us as physicians to not only give true medications, right? Because in some cases we have to, but really to allow those medicines to work well and have the patient have this positive self image, I think incorporating those things is going to be key. And I guess for me, that's that holistic piece. As you know, I am on social media and my patients, they follow me. I'm a Zumba instructor as well. So during COVID, my patients couldn't get out. So guess what? They logged on and we did Zumba together. Of course, if they were healthy enough. I frequent the fair amount of restaurants, both locally and nationally. And while I'm there, I say, hey, you want me to talk about plant-based nutrition? Sure. And so I think as physicians start to get outside of this very paternalistic space of I am doctor and move to the space where I am patient, we start to shift this pendulum. And that pendulum is moving from the vulnerable plaque to the vulnerable patient. And once you make that connection, that's when you truly embrace what healthcare and medicine is supposed to be.
I've been kind of talking to a lot of doctors across the country, and one of the things that kind of bubbled out of this, you're good with acronyms. I'm kind of good with just like alliteration. And so the three T's of like patient to doctor communication, how it's been transformed. The way I looked at it is like number one is being transparent. You talked about that, right? Just being open and vulnerable about your background and why plant-based and why a holistic, lifestyle is important for you personally. So that opens up patients more to kind of listen to. The next T, testimony, right? Your story of how you got down this pathway, right? And then finally, that opens up the truth. The patients are willing to kind of share their truth with you, and so you can communicate. And now, to your point, we're seeing a lot of doctors who kind of do this 3T in this kind of order. We're seeing them open up their patients more and more with, and that's really what's important, right? We'll talk about in a second, but with the advent of artificial intelligence and these other technology tools, which are great and wonderful, as practitioners, as physicians, I think it's important that you have a tighter connection to your patients, because the AI can probably diagnose a patient eventually better than you can, but ultimately the patient is going to trust you more. Potentially over time,
No,
when you
and
look into this.
yeah, and if anyone wants to know more, this is another plug. Mr. Harvey has a great show where he gets one of the key, I think he's a doctor on TikTok that basically plugged into AI and had a discussion about, will AI ever replace doctors? And the doctor had one spin, but Mr. Harvey really kind of breaks that thing apart. So if you all are interested in, and I say AI, but as I sit here with an Aura Ring, shameless plug for Aura, as I sit with my Apple Watch, as I sit with all these wearables that now are components of my physical exam. Hey, how's your heart rate recovery been? I don't know, doc. Oh, well, pull up your Apple data or send that to me before your appointment. Hey, how are you sleeping? Oh, send me your Aura Ring data so I can look at your sleep latency and those types. I mean, this is where healthcare is good. That is what precision medicine is. And I think that not to feel like AI is an emergency that you have to shield yourself from. I think it's an opportunity for us to embrace it and really truly understand how to leverage these opportunities through the virtual health space and through those other things that individuals such as Mr. Harvey offers. There's another plug, because like I said, didn't have a ton of time to look at everything, but the content that you put out that really leverages technology to enhance patient care is truly fascinating. And I thank you for that.
No, thank you for that as well, Dr. Batts. And I think to us, when you look at technology, I was a technologist first. I used to work for tech companies for years before I got into this space about 15 years ago. And to me, healthcare always lags, technology. But the important thing, it has to, right? Because the patient, what's the Hippocratic oath? Do no harm, right? And so technology, unfortunately, can do some harm, right? And so you have to mirror the both to kind of, because that's where you get your innovation, but also you have to be, mindful of that. And so to your point, yes, I did talk about that. One of the things, unfortunately, right now, AI tends to do a thing called hallucinate. So it'll start making up stuff, right? To just give you an answer, whereas there's no basis in studies or fact. And that's never good for anybody, right? But as doctors learn to kind of, like you said, put themselves out there more, be more transparent, giving a testimony and getting to the truth, I think we'll see more and more opportunities for doctors still stay on the forefront and use AI as any tool, right? Just like any diagnostic tool or anything else you do, or test or whatever. It's a part of how you deliver care.
Just the other thing that we have to be, at least I think this is a good place to introduce this discussion piece, is the other thing we have to be cautious about with AI is that there was one thought that, well, AI would eliminate bias in healthcare, right? There's this both implicit bias that is ingrained, and it's unfortunate that it's there. But if you give AI a similar group of tasks, there is a risk. And so that's where, again, buyer beware. Just understand that AI uses the content or data from the environment to come up with what that plan is. And sometimes there may be components of bias that are there, particularly when you look at disparities in healthcare. So not to take us off that path, but I feel like it's important that we identify not only the risk of AI hallucinations, but also the potential risk of bias. So implicit and explicit bias in that sense.
Great point. I mean, bad data in, bad data out, right? So
Hmm.
these AI systems, they have these neural networks, right? That's just kind of, acting like our brain. So if you train a child just like they train AI and you put them in front of content on the internet, right? They're going to have certain biases that form over time, just like you wouldn't put your 5-year-old in front of YouTube all day. That's
Hope not.
basically what's happening. Yeah. So you made a good point. There is a lot of biases and can mess up how AI is trained, and that's why there's some studies that have shown that they're kind of at the limit now, and they're still looking at these AI companies like OpenAI and others are looking for more data sets because they're kind of at the limit of what they can ingest. So they're looking for other kind of content. So no, thank you for bringing that up. One things that you did mention COVID, you mentioned social media. Look, you're out there, you're promoting your expertise. A lot of doctors that we talk to are doing the same thing, and that's how we integrate with them and communicate with them. But a lot of doctors that we talk to, they're kind of hesitant, right, to do that, right? What is some advice you would give some of the doctors that we talk to who're so busy with practice and doing the day to day that they don't see the importance of putting themselves out there with social media, or maybe they feel fearful because they don't want to say the wrong thing and have a HIPAA violation or anything like that? What are some of your thoughts, and how do you talk to doctors about if they're kind of dipping their toe in this? What should they do?
Well, no, great question. And again, that road to social media is different for everyone. I mean, if you can't tell, I've never met a camera that I didn't like, right? but, but but part of that is because I know that messages have power. I know that there is power in content. I know that many times patients, and I'll say this, won't see doctors that look like me or that think like me or that have a shared mental model or a shared collective cultural context that allows them to say, okay, that's how he did it. Let me do it that way. And I think each provider has something to offer. Now, back during COVID, and I'll applaud both the Association of Black Cardiologists as well as the American College of Cardiology, there was this push to help physicians understand this concept of branding. We made the joke earlier when we were talking about the setup that they didn't teach you this in medical school. And you are right. They did not teach us about branding. They taught us how to provide healthcare. They taught us how to do medicine, for lack of a better term. But as healthcare and social media and various things have evolved, we have to meet patients where they are. So if I had just three quick things, so for that physician that is on the fence about how to integrate themselves into social media, I mean, I would almost say, go about it either with the three T's that Mr. Harvey just spoke of, right? Even if you don't want to put your face on camera, I mean, there are ways to, kind of read something, have images go across, and again, 30 seconds of that, sending it out. I mean, that, post something about blood pressure, post something about, for me, heart disease. If it's a month and it's your month for February, I am busy. I am locked in. We are booking out events in February now where I'll go speak, at a barber shop or at a church or various things like that. If you say, well, I don't have the camera, I don't have this, the best camera you have is the one you have on you. Most iPhones or Androids are good enough to where you hook them up, say what you need to say, post that out there. And trust me, that patients will embrace your transparency. They'll embrace your truth and they'll appreciate your time, right? That's a different T. Those were the three, but I love that transparency and truth. They'll embrace those things. And what you'll find is that now you'll start to be a little bit more comfortable. Now you'll start to anticipate, like November is National Diabetes Awareness Month. So guess what content is coming out in a couple of weeks for me? We're going to have a discussion about diabetes, right? So align it. One thing that I say, and then I'll let you hop on and guide, because I can talk about this all day. The one thing I tell providers or anyone that is looking to have a message and want that thing to last is link your likes, right? Not necessarily people liking, but the things that you like to do, try to link them in your message. For me, I love fitness. I love nutrition. I love healthcare, and I love cardiology. Moreover, I love my family. So a lot of the things that you'll see is me working out with my kids or having a discussion with my daughter about recovery or talking to my wife about complementary meals where my wife and family are not vegan, so they want steak, but I'll make a portobello mushroom steak, is understanding that balance that exists. And so a lot of it is the things that you like, it's easier to talk about. They appear more natural, right? And so in that, just like this conversation with Mr. Harvey, he's brilliant. I love talking to smart people. So I'm enjoying this, and it's natural. And whatever we want to do from a social media standpoint, we already have it. So what I would say is just press
Mm.
record, and get out there.
Mhm. I mean, and I think there's hesitation. Even folks who may not be doctors, just putting their expertise out there. But I'm just thinking back to Dr. Jane Morgan. I had an interview with her. She's a cardiologist out of Atlanta. She just did these sterile chronicles where she talked during COVID of different things you can do, and that helped her to kind of get her message out there. Or Dr. Refi, who was a nephrologist, he talked about breathing. How what breathing techniques you can do, right, to kind of help you if you feel like you're suffering. And then Dr. Epstein, who also was a cardiologist, really kind of saying his patients were kept asking the same questions over and over again. So he wanted to create a way in the space where he can kind of answer that in a video format. So to your point, I think it has to start with that intention and, getting through, not looking at yourself as hey, I'm out here just putting myself out there, but no, I'm putting myself out there to help someone. And if you kind of stay with
Right.
that focus, it makes creating that content easier. So no, thank you for that. Oh wow, this has been a great conversation. Really enjoyed talking to you, Dr. Batts. What's next for you? I know you're out there speaking, doing great things out there. So what's going on? Like you mentioned, as we were recording this, is November, heading into the holidays. Anything that's coming up for you?
Yeah, a few things. And again, if I don't say it now, I don't want to forget. Thank you again for having me on the show. I would encourage people to visit both your podcast and your YouTube channel. It is informative. It is not only for providers. I tell my patients, look at what doctors look at, right? Read those magazines, see why they're telling you to do XYZ. They oftentimes will put it in plain speak, and Mr. Harvey does a wonderful job of that. For me, as I mentioned, I have a podcast as well. It's the About That Life podcast, where life stands for living intentionally forever. We really talk about those strategies for lifestyle medicine, but I bring different folks on, and we talk about either issues that are germane for that month or different things that have come up. We have a couple of spin-off series from the podcast. The one that you all will see is Life After the Locker Room. This is where I talk to a host of professional athletes, whether they be NFL players, Olympians, NBA players, and really talk about what their health journey was after being an elite athlete. Then another spinoff is called Iron Therapy. And this is where myself, a professional bodybuilder, and you ready for this? A semi-pro bodybuilder who's also a psychiatrist get together in a gym. We lift weights and we talk about mental health issues affecting all communities, but particularly communities of color. That series will start in January and likely run through April. We'll see kind of what that looks like. Other than that, folks can reach me on all social media platforms. Also, you can visit me on my website at www.drdrtravis, Travis, Batts, Batts.com. There you can email, have discussions. I have a host of speaking engagements coming up through the holidays, but then I take a break and just get to be dad. But, if I'm dad, we're going to be live streaming some training at the gym at my home. So we'll be doing Vertimax training, Raptor training. My son, I'm trying to turn him into a defensive back. And so we'll have some fun. So we may post some of those things, but as you can see, I love it. Would do it for free and really just appreciate the opportunity to engage.
Oh, I love it. I love it. I need to post my son's workout. He's 8 years old, basketball player. So maybe we'll do
Okay.
dueling post videos. But anyway, during the holiday. Well, Dr. Batts, this is very informative. Look, go check him out. His expertise is phenomenal. But not just that, but just his intention of being out there. So if you're a doctor listening to this, or a medical practice owner, or just a patient, definitely, you can trust individuals that are putting themselves out there and giving you the real information, especially as we look as healthcare is changing. We want to change in that direction to this new normal. So thank you again, Dr. Travis Batts.
Thank you. Have a great day.